World Allergy Organization's conference at Lebanon, and the novel approach to the worldwide allergy epidemic, it was mentioned. So allergy is an epidemic nowadays. And if you see in India also, around 30% of the population is going to suffer with some or the other allergies. So especially in children, it is the number one chronic disease. 2013 data showed that more than 400 million people are suffering with some or the other allergy in India. And so even like people are scared about cancer, but cancer is not a big killer. Even chronic obstructive pulmonary diseases, which has been a second death-causing disease in India. And even 3 years back, we presented a paper in European Academy around more than 68,000 chronic respiratory diseases patients, whatever last 27 years of our data. And we found that a lot of people in some or the other in their lifetime had allergic inflammation, maybe with the rhinitis, asthma, or they had a significant skin problems of allergy, sinusitis, viral keratoconjunctivitis, something. So allergy asthma COPD overlap syndrome is very well known. Even 2017, there was a paper publication on that, and it's documented. So even as a practitioners, we should always ask the history. Is any family member suffering with allergy? So even people don't know that asthma is also one of the allergy. Like 90% of the children with asthma have an underlying allergy. Adults also 60 to 85% of the adults are having some or the other allergen as a trigger. And then besides that, any eczemas, atopic march, like even obstructive sleep apnea, snoring, allergic conjunctivitis or something, you have to ask. And you can see this chart how the next generation can have a very severe allergy. So it's a growing disease basically, and day by day the cases are increasing. And you can see there are multiple factors, like even the pesticide use, artificial fertilization, the environment changing, lifestyle changing, then exposure to the tobaccos. Still the bio-waste fuels are burned as a firewoods, then in the infancy increase antibiotics and NSAIDs. So again, nowadays the cutaneous sensitivity from the baby's skin to the grains and the grain dust and all can sensitize the child to the food allergies. So this was a child with a typical, like we all know, with eczema, and he was suppressed with the steroids and all. You can see the hypopigmentation was there. This was another child with having a significant ocular allergy. You can see the upper caries teeth and the turbinate hypertrophy. Then this was a very affluent family. The child had been there. Severe photophobia, even early cataract changes were happening because of the repeated eye steroids. This child had a GERD, vomitings in the infancy. He was treated for that. In between, he was better. Then he had skin eczema, atopic dermatitis, then repeated cold, throat infections, cough. So he was on inhalation, nebulization therapy. Now he has severe ocular allergy. So allergy is a progressive disease. In between, there can be a window period, or it can be in the dormant phase, but the minimal persistent inflammation continues and the newer sensitivities increase on. So even nowadays, it's a big problem. Since 2018, the World Allergy Organization has said allergic conjunctivitis is a very big problem. 95% of the allergic rhinitis people have the ocular allergy, and 25% of the rhinitis patients, severe ocular allergy is underdiagnosed and not properly treated. So you can see like how the nose mucosa, which is connected to the sinuses, to the eyes, to the nasolacrimal duct, as well as the nasoocular reflex, and then lower down it can go to the airways, and when it can lead to the skin problems or gastrointestinal. So the child with a severe anaphylaxis admitted after post 2-3 days, he had such a edemas and all. And this patient, actually, he was just, if he would have been late for 5 minutes, he would have lost the life. And this child, you can see the palpebral conjunctiva, so much significance. Some or the other time, he had some rhinitis and conjunctivitis. Then this was another patient with a significant turbinate hypertrophy. He used to have mouth ulcers, you can see the upper caries teeth and all. And because of the oral food allergy syndrome and all, used to have such type of presentations. This was another girl with significant viral keratoconjunctivitis affecting the quality of life. this is a routine thing. Like you see a lot of people with the brush, but this terminate hypertrophy you can see in these patients. This was a young girl, 19 years old, with terminate hypertrophy. You can see the swollen tongue still. And this young adolescent was suggested tonsillectomy and adenoidectomy. You can see the terminate hypertrophy. We started managing with the proper allergy, the nasal sprays, then nasal douching, then allergy testing was done, desensitization with the safer anti-inflammatory to control the mast cell and inflammation. Within 1.5 years, her tonsils got regressed. She did not require a surgery. Why the surgery? Nowadays, it has been found that tonsil, adenoids, or even deviated nasal septum sinuses, if it is still absolutely not necessarily, you should not touch it. Otherwise, these people in an early stage have a lower airway involvement or asthma or something. So you can see like how this denim organ folds. This child had a fixed drug eruption with after any NSAIDs and some antibiotics. So you can see like so this is a medicine triggered rash. And such type of cases have increased now. Even drug allergies has increased more. Like this patient had been urticaria repeatedly. You can see the terminate hypertrophy was significant. So these patients, some of the patients, when there is a strong family history, and suppose there are hidden signs of allergy in these patients, the foods or some of the pollens like parthenium and all also can be picked up, animal danders or pigeon feathers and all. It can help in some type such type of patients. This was a child, you can see the long eyelashes. He was referred from one of the corporate hospital. He was admitted there in ICU. He had a seizure disorder because of the hypoxia, because of the anaphylaxis, because he had a peanut butter and he was admitted in the ICU. But actually, the peanut butter was contaminated with the dust mite. When we did tests and we found specifically this dust mite sensitivity was more. And even with the component is all diagnosis and the skin prick test, that's why sensitivity was confirmed in these patients. So, the young adolescent from one of the engineering college, you can see the angioedema and all. And as this picture has shown how it is connected from within. That this, the first child, which had shown a eczema, and afterwards he been a toddler and he started having a infected eczema, and his quality of life was suffering. So once we did a testing, it was a dust mite sensitivity, which was missed by the other dermatologists. So you can see this child, which is such a significant atopic dermatitis, and he was said that up to 10 to 12 years maybe because his IgE level was around 3,500. Significant, he used to have bleeding after itching and all. And once after the allergy test and he had a milk sensitivity, we started managing these allergens and with the safer belastin montelukast combination as well as whenever required fexofenadine and all. And he showed a very good response within 9 months. You can see like how his clearance has happened. So allergy is a basically hypersensitivity reaction, and there is a lot of misconceptions amongst the community that it is a lower immunity. It is not that way. It is a hypersensitivity, and repeated exposure to the allergens, it causes a sensitization, and once it level reaches to that level, then the tissue or organ damage or dysfunction happens to the different body parts. And you can see this picture like how the dendritic cells get sensitized initially with the food, and then the oral food allergy can happen. So the Th2 inflammation increases. So type 1, type 2, type 3, type 4 hypersensitivities are there. Depending on that, the reactions will be there. So simple to remember that prior antigen exposure should be there. Then the specific Ig for the specific allergen is formed. And once it reaches to one level, then the histamine and other inflammatory mediators are secreted. And then these antigens bridges the gap between the two antibody molecules. Degranulation of the cells and release of histamine and other mediators cause a inflammation and the symptoms. So basically, avoidance measures can reduce the exposure and thereby reduce the symptoms in the patients. So symptomatic management we are doing, but the avoidance measures are also very important. So as a practitioners, we all should pick up these protruded mandible or teeth brasses, middle ear pathologies. So never miss with the otoscope should be there, the cervical lymphadenopathy, any hidden signs, like 70% of the patients with rhinosinusitis, rhinoconjunctivitis, or asthma has a dry, irritated skin, itching skin. Then polyps, turbinate hypertrophy, like posterior pharyngeal hyperplasia in the oropharynx should be picked up. Then allergic shyness, like Rhinosinusitis, blackening under the eye, allergic salute, rubbing the nose in the upward direction, denim organ fold, long silky eyelashes, constant mouth breathing or snoring, horizontal line because of the fold over here, and these lateral creases can be there. So you can see the picture how it has shown the this bluish black discoloration, then this denim organ folds, then this long eyelashes or watering of the eyes, this open mouth breathing, this allergic salute, then this turbinate hypertrophy. It does not require any instrument. Then this horizontal derriere line, then facial grimaces like this, and then hypertrophy infant turbinate and posterior pharyngeal hyperplasia like a cobblestone appearance into the foot. So it's a systemic disorder, and from one part to the another, when it will be there without any significant symptoms, but the underlying inflammation continues. So even so many cases have found that the risk of asthma, chronic respiratory disease, because of the altered immune reactions, and even managing this allergic inflammation. Remember that these whatever the previously we used to talk about the diet, microbial balance, sunlight exposure, vitamin D, passive smoking exposures, and all should not be missed. And even the newer therapies like biologics are the targeted therapies than the oral and parenteral steroids. So in India, there are a lot of steroids are used. Rather than that, these in the next lectures we will see about the details of these things. But we'll always remember that in acute phase, most of the patients they respond to the simple antihistaminics. But once they go into the chronic phase, a lot of other lymphokines, cytokines are secreted, and the histamine antihistaminic does not respond much. So remember these grass pollens, flower pollens, tree pollens, insect droppings, diet feather. Animal dander can travel around 15 to 16 kilometers. Dust mites are in crowds in the beds, sofas, curtains. Funguses, we found around 65 patients with severe asthma having a molds into the school bathroom offices and all. Some of the patients, 2 to 8% can have a food allergy also. So you can see how these ultraviolet rays cameras can pick up the these and this allergic march we should keep in the mind. 50% of the eczema is going into asthma, and later on, many of them going to rhinitis, sinusitis. This Th2 inflammation, which triggers the allergies, and Th1 suppression happens, which causes a secondary infection. So, as the family history will be there, and depending on the clinical presentation of these patients, we have to improve the quality of life to stop the allergic march and further complications in these patients. And the early childhood, most of the patients have food or eczema. Later on, they go into rhinitis, conjunctivitis, asthma. So these patients, besides just symptomatic management, the proper allergen identification definitely can help in these patients to improve the quality of life, to reduce the medicines, and to stop the allergic march. So even if you see all the international national guidelines, avoidance measures, symptomatic safer medications, and desensitization or immunotherapy in selected specific patients. Again, safe antihistamines should be prescribed than the unnecessarily first generation antihistaminics. So you can see like 93% of the patients with rhinitis can be picked up with this. 65% of the adults with asthma, even children's 85% of the patients can show a very good skin prick test, which is a gold standard. Rather than very few patients may require a immunocap or component result diagnosis for the food allergy testing. So you can see like how skin prick test is really within 40 minutes, all the patient is out of the clinic with the reports in their hands. And even nowadays, 1 millimeter tip lancets are available, very safe, painless, bloodless. There is no age limit for anything patients. After 6 months, most of the children were doing it. And suppose required, even a smaller children, so infants also will do that. And the specific IG allergens, you can see like all these pollens, mites, parasites, then dusts, insects, grass pollens. We did a project actually, and like in Indian scenario also, the dust mites and the pollens and molds, these are very important. And then John fever around 37 to 40% of the patients. So once we allergen identification happens, then we can have a very good control on the disease and we can stop the progress. So if you see even 1998, the World Health Organization paper, rest of the other medicines and all we are giving, oral parenteral steroids are so much used. Rather than that, monoclonal antibodies can be used, but allergen contact and avoidance measures and immunotherapy, desensitization, which is the only disease-modifying therapy to stop the newer sensitivities and progression of the disease. How allergen immunotherapy, in brief, I am mentioning. Next lectures, we will go into the details. Basically, the Th2, it reverses the Th1 cytokines and they form the IgG1, IgG4 antibodies. So, long-term wise, the mast cells, eosinophils, and all, they are also controlled and the tissue reduction and the inflammatory mediator reduction goes down. Avoidance measures and immunotherapy can play a very good important role. Indoor allergens are very important factors in most of the patients. In 2017, Indian Allergy Asthma Guidelines also shared allergy-focused medical history is very important. Allergy diagnosis by the skin prick test, allergen avoidance, and then immunotherapy. So specific allergen immunotherapy for specific dust mites or pollens or insects, depending on the anaphylaxis or something. And again, there is a misconception into the community that it is a very costly treatment. Nothing, hardly 100 rupees per allergen testing is there. So we select the allergens and depending on that. And once we avoid the things, definitely the medications can come down slowly and long-term wise, the patient don't require many medications. And even if you see the cost of the therapy long-term wise also, it is very cost effective and the patient have a benefit of it. So considering all these allergic diseases have increased a lot and atopic march from and then the other complications, we should come together and whatever the international standard guidelines have mentioned that proper allergy management means it's not just symptom or antihistaminics and all. It is how in a diabetes we do the sugar test. The same way here also, we should manage the allergy by the allergen avoidance also, some safe medications also, some simple precautions, and long-term way, whenever it is like required, the desensitization can definitely prevent the severity of the disease and it can prevent the newer sensitivities and long-term complications of the allergy. And so it's a progressive disease. It is not a just one childhood asthma is overcome means the child has overcome the allergy and now he's out of allergy. Nothing. Suppose sinusitis has been treated or suppose tonsils have been removed and all. Allergy never goes away. It always continues. So we have to manage it properly. So thanks a lot.